My name is Heather Fite, and today we are going to be talking about anxiety within pediatrics. The prevalence of anxiety in children has increased in recent years, and caregivers have limited knowledge on how to help their child manage the effects of this anxiety. Anxiety can impact the child in ways such as diminished quality of life and social participation. The definition of anxiety is apprehension or excessive fear about real or imagined circumstances characterized by worry, concern, and uncertainty. Anxiety can manifest itself in various ways such as overreactiveness, irritability, perfectionism, avoidance, restlessness, impulsivity, dizziness, and nausea. These symptoms influence a person's ability to fully and effectively engage in their daily routines. Through natural development, having some anxiety is appropriate and at times necessary. It allows humans to increase our self and environmental awareness, as well as our problem-solving skills. When it begins to influence one's thinking, behavior, and/or physical reactions, and when it is excessive and uncontrollable, that is when it becomes an issue. Anxiety within pediatrics is the most common psychiatric condition, the mean age of receiving a diagnosis of anxiety being 6, and there being a lifelong occurrence of approximately 32%. Due to anxiety being one of the highest diagnosed psychiatric disorders within pediatrics, extensive research has been conducted. A study by Mash and Barkley in 2003 identified the different types of anxiety disorders that children can be diagnosed with. These include separation anxiety, social phobia, obsessive compulsive disorder, specific phobias, generalized anxiety disorder, and panic disorders. When a child experiences anxiety at a high rate of consistency, it can have a severe impact on the child's overall function and engagement within their educational, social, and age-appropriate developmental tasks. When a child is in a state of constant worry, contemplating what others do not, this influences their overall ability to participate in activities that require their full mental faculties, such as school-related work, peer engagement activities, and activities of daily living. Occupational therapy originated within the mental health field, specifically within psychiatrics, during the moral treatment movement, helping persons participate in meaningful activities and healthy routines within daily living. Along with increasing one's overall independence and participation within their daily routines, occupational therapists also have the ability and skill set to play the role of group leader, program developer, case manager, consultant, advocate, and community mental health provider. For these reasons, occupational therapy should be at the forefront of aiding in mental health concerns within the pediatric and adolescent populations. Since I have been working as a pediatric occupational therapist for the last 8.5 years, I have witnessed the effects that anxiety has on children and their families firsthand. Many times, caregivers don't know what to do to help their child, what professionals to work with, or what interventions to utilize. It is within the scope of occupational therapy to collaborate with and educate caregivers in evidence-based sensory and motor strategies to decrease the impact of anxiety on their child's lives. Research has been conducted on different sensory and motor interventions and the effects that it has on anxiety. Such interventions include yoga, play, and self-expression through journaling and art. The utilization of yoga as an intervention can help children manage and cope with the effects that anxiety has on their lives by improving their mental health and overall well-being. Decreasing their anxiety and its impact on their daily living skills can also enhance their ability to participate at a higher level within social engagement, school, and other activities. Play-based interventions were proven to be effective amongst children ages 3 to 15 across a variety of different settings. It also allows children to conceptualize and work through various scenarios, gain increased understanding, and prepare for medical interventions. Play as an intervention for anxiety also helps children learn age-appropriate play skills, develop successful coping strategies, and increase their overall well-being. Utilizing art therapy has proven to be useful for children ages 2 to 21 years of age, across different contexts and experiencing anxiety in various forms. Art-based interventions allow the child to process, conceptualize, and express their feelings, allowing an outlet for their anxiety. It empowers and improves their coping strategies and influences their overall mental health and well-being throughout their daily lives. Thank you for joining me today, and for more information, please go to my website, hfight823 at wixsite.com. Thank you. Have a good day.